Trauma in the medical world has traditionally meant trauma and orthopedics. You've been hit by a bus, you've got frank injury to your leg, and that is also trauma. We mean, in most terms these days, trauma to be anything which overwhelms the nervous system's ability to cope. There's a part of our nervous system which is called the autonomic nervous system that governs, as the name implies, lots of involuntary actions. Your pupils dilate, your gastric secretions commence or stop, heart rate goes up, etc. All of that is happening in the background by a part of our nervous system called the autonomic nervous system. Some of that originates in the brain stem. The most famous nerve at the moment is the vagus nerve, and which is the 10th cranial nerve, which comes out from the brain stem. A lot of these autonomic nervous system processes are very primitive in our nervous system and help us to stay alive. Fear, fight, flight, or freeze responses that people have heard about are connected to this autonomic nervous system. So if we suddenly had a tiger run into the room right now, then we would have an autonomic nervous system response. Our sympathetic nervous system would respond in some way. It would try to mobilize us to run out through the door, the window, or stupidly try and fight the tiger. But we might well go, we don't have a way out of this. Now, then we might freeze, because primitively, you see animals that might freeze and play dead, like an opossum. And that's a survival mechanism too. We have a capacity like a river, and if we have too much rain too fast too soon, too much, too fast, too soon, or not enough is another expression sometimes for trauma. So if we're looking at developmental trauma and say neglect, for example, then not enough can be also traumatic. If you imagine too much rain too fast, too soon, then it would overload the river's capacity to cope with it. Yeah? And so we may breach the riverbanks. This will cause what we call a trauma vortex. And that overwhelm of the nervous system is really what we're talking about with trauma. Now, what does that mean for the body? Well, it means that we're then not able to regulate those processes within the body. And so we can become stuck in a sort of vicious circle with certain aspects of our body. That might mean that, for example, if we get an echo of something familiar about a past event, if our system hasn't resolved it properly because it's been overwhelmed, then it gets triggered and it responds as if it was back there. So we may have an over-the-top reaction in our behaviors and in our physiology. That might mean that every time we have a particular thought or a particular stimulus or a particular behavior coming in from somebody else, that might cause us to feel tension build, and then often as we're trying to cope in life, because we all have traumas in life, we can't get through life. Being a baby is pretty traumatic. We can't get through life without trauma. And so we've all got stuff. It's just how we cope. Now, if we, in order to cope, might have to shut some of these things down, these processes down. So if we suddenly thinking, oh gosh, well, there's this rising sensation in my body and it's coming up and I'm feeling like, what do I do? And I'm feeling, well, I can't cope with this. It might be that I just find that if I just put some tension into my shoulder here, then actually somehow that stops. Well, now we've got a chronic tension pattern here that can get triggered frequently. And it's like that is charge. That's stuck energy, if you will. Stuck charge in the system that we might need to discharge. It's known in the research actually that if we just talk about trauma, we can actually re-traumatize the patient, because if you're not careful, you're just going to relive the experience and relive the processes and the systems in the body. And it's through gently understanding how the body is holding patterns from the past and what that's doing to disturb the normal function of any organ, any part of the body. That really is an understanding of how trauma affects the body. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.